What about complications with each group too? Because we just saw that more people preferred to have the bone marrow injection as compared to the knee replacement. But what about complications? There's another study that he did looking at comparing two knee replacements, so bilateral knee replacements, versus bilateral cell therapy or bone marrow, and followed the complications for those two. He did other things in there too, but I'm just going to focus on that. So in the bilateral knee replacement group, he had 160 patients and 320 knees. They had more than 25% complications in there. And then in the bilateral simultaneous bone marrow group, they had less than 5% complications in there. So, translation, the bilateral knee replacement group had much higher complication rate than the bone marrow injection group. When Dr. Hernigo looked at the failure rate of either one of these procedures, knee replacement or the bone marrow, nothing works 100%, and we all know that, right? So, but what's the difference between these? Does one work better than the other? And the definition for the knee replacement group is they need more surgery, another surgery. For the bone marrow injection group, definition is they need to get the knee replacement. So he looked at people who are over 80 years old. So this is significant group of people older. And what he saw was at 15 years, the difference between the groups was 20% failure rate. So which one did better, knee replacement or the bone marrow? Bone marrow did better. So 20% fewer needed to have a knee replacement as compared to the knee replacement group, where more of them needed to have another knee replacement. So when we look at all these things together, we see knee replacement versus bone marrow. Both do work, but more people prefer to get the bone marrow. In Dr. Hernigo's study here, there are fewer complications in this bone marrow group, and fewer of them need to have another procedure or have failed. So overall, looking at knee replacement versus bone marrow, you decide.